For the next of, we are looking at polycythemia, and this polycythemia, you are looking at polycythemia, how it can be able to cause heart failure in children. Okay, how polycythemia can be able to cause heart failure in children. So for the polycythemia, of course, polycythemia is it red blood cells? Yeah, red blood cells are too much. Poly, something is too much. Alright, so your normal red blood cell count should be like this, but in polycythemia, you have like a lot of those, white blood cells being left back in the system. So you're having all those complications. Alright, so it can lead to heart failure. Now let's look at the linkages between this. So first, polycythemia is known as a condition marked by abnormal high concentration of red blood cells. So this can lead to heart failure in children through several interconnected mechanisms. So though it is rare, but when it occurs, alright, in especially neonates and children with any other issues again, do you understand? It becomes much more serious. That means it single-handedly, it can really cause heart failure, but it can now collaborate with other issues. You understand? So how polycythemia impacts the heart? By increasing blood viscosity. So excess red blood cells make the blood thicker. So this slows circulation and increased resistance. So it forcing the heart to work more than it should. So over time, this strain leads to ventricular hypertrophy and eventually leads to heart failure. Okay. Next, reduced tissue oxygenation. So despite having more red blood cells, oxygen delivery can be impaired because there's a resistance to the flow. The blood is thicker, it is hyperviscous. Okay. So the heart compensates by increasing cardiac output, which may not be sustainable long term. Pulmonary hypertension. So thick blood can elevate pressures in the lung vessels. So this stresses the right side of the heart, and this will actually lead to right-sided heart failure. So thrombotic complications. Right? As the blood is flowing slow, there's a risk of the blood clotting. Of course, if you keep blood in one place for a very long time, it becomes solid. So clotting coronary or pulmonary vessels can directly impair heart function or even cause infarction. Okay, so that's it for how polycythemia, high concentration of red blood cells, is actually linked to heart failure in children.